So I think it was very timely, actually, that just about a month ago, the U.S. Preventative Services Task Force reconsidered their recommendation, and so it went from a grade D to a grade C recommendation in their draft recommendation guidelines. And so instead of saying there's no reason to do a prostate needle biopsy, now it's more of an individual choice. And I think that aligns more closely with what other professional organizations are saying. So I think that strikes probably a good balance. On the other hand, we do know that, for instance, when you compare the use of PSA screening versus mammography, it actually compares pretty favorably in terms of the number of men for PSA testing needed to screen to prevent one death, and that number is actually lower with PSA testing than for mammography, which has a grade B recommendation. And so I think others have looked at, and we've talked about in the past, how some of this is affected by maybe men aren't as vocal in terms of their advocacy, but it was a nice thing for the AUA to do this year to really have a advisor to the task force, who was David Penson, and I think that led to considerable potential sway in changing their recommendation back from a D to a C.